Hi, I'm Peter Schneider, co-founder of Cagent Vascular. I am a vascular surgeon at the University of California, San Francisco. Of all the things we do as vascular specialists, amputation prevention is among the absolute most important to our patients and to society. BTK disease is the usual culprit that we must manage day in and day out. The below-the-knee arteries are becoming the big challenge in limb salvage and in vascular practices across the world, where the development of CLTI, or limb-threatening ischemia, among the patients we take care of has become, it's really assuming a role that is dramatic and dominant in hospitals across the world. And yet, the primary technology that we use in 2021 is balloon angioplasty, which was invented 60, 70 plus years ago. It has served us well. It's simple, it's easy, it's straightforward, and yet there's some downstream problems. For one thing, it doesn't always create the lumen that we need, and it doesn't always serve the patient well. And we know that from poor long-term patency data that we have on plain balloon angioplasty. So for the below-the-knee arteries in particular, I think this is an area where, when targeted with new technologies that can surpass what we've offered in the past, this is where let's just say, the value proposition, the reward for our efforts is so much greater than almost anything else, because it means saving limbs. It means keeping the patient whole. And so the concept that's come up about serration angioplasty, it's really about making angioplasty better than it's ever been before. And if you think about serrations, if you will, I mean, I don't know if you still own a checkbook, but if you ever did, every checkbook has serrations in it, so you can get the check out cleanly. Every yellow pad has serrations on it. Every FedEx box that you open, every box of crackers, they all have serrations. And there's a reason they have serrations. They want you to be able to direct your energy along a specific plane, along a specific line, so that that energy can be well used, and it's not just distributed in random fashion across the structure, in this case across the blood vessel. So the potential for a different mechanism of action than balloon angioplasty is really there. With serration technology, we can actually create, in a very microscopic, localized environment, 1,000 times the force of a plain balloon. And the key is not to deliver that force randomly or willy-nilly across the balloon surface. The key, I think, is to create these very specific and localized points that then form essentially a symmetrical stress relief plane, where the energy of the balloon expansion that then follows the serration, the creation of serrations, the energy of the balloon that follows, is allowed to be directed along that line, so that the artery can expand in its most pleasing possible way. So even though you may have this incredibly heterogeneous lesion, this very highly, let's say, idiosyncratic lesion with a certain amount of calcium and a certain amount of plaque and a certain configuration, the best way to open it is going to be with a symmetrical stress relief plane. And the way to create it is with point force technology. It's a simple development, in my estimation, that could lead to dramatically different results. And what we have found in our studies, in the Prelude BTK study specifically, is exceptional lumen gain. That is, less residual stenosis than has been previously reported using other technologies. And again, this is a modified balloon in the sense that We have modified it to be able to create serrations and to perform serration angioplasty using point force technology. But really, it's the stress relief, if you will, the release plane that allows the balloon energy to be directed along a specific line.